Hey guys, today we'll be learning the next chapter, chapter number 16, which is for newborns and perinatal conditions. The course series starts with P. In yesterday's video, you have learnt about pregnancy. Today we'll be learning what are the codes needed in newborns or perinatal condition. For pregnancy, we have time frame, right? For trimester, we have 14 days, 14 to 28 and more than 28 till delivery, as well as for postpartum. Postpartum, we have 6 weeks of time. In the same way, for newborns, whenever you have a newborn account, if the age is less than 28 days, then you can go with P series. Once it crosses 28, from 29th day, you need to assign normal regular chapter series code. The time frame for newborn is 28 days. Remember this, please make a note of it. Now let's move on to the general guidelines which we have in newborns. The first guideline, whenever a patient, a mother admitted to the hospital and delivered a healthy baby, in this case don't use mother's code here. You need to use only chapter 16, not chapter 15. Chapter 15 is separate, which is pregnancy. Chapter 16 is for only absolutely for newborn case. Don't confuse between chapter 16, which is pregnancy, as well as chapter 15 is for pregnancy, as well as chapter 16 is for newborn. And whenever you are reviewing any account, if that account is maternal or pregnancy or mother chart, go with chapter 15 pregnancy. If you are coding any newborn account or any perinatal conditions or any baby which is less than 28 days of age, you need to go with chapter number 16, which is P series. Clear? Let's start with first guideline, which is first listed conditions or principal diagnosis in newborn. Whenever a newborn has delivered in an hospital, we need to assign Z38.00 for vaginal, as well as Z38.01 for C-section. This is the first listed diagnosis. This condition or this code we cannot assign as secondary. If a patient is delivered or gave birth, or the date of birth of that patient is today and delivered on the same hospital, in that case you will be assigning Z38 as your first listed diagnosis. And if a patient is discharged and admitted again within 2 to 3 days, then you can go with P series. But whenever the patient gave birth, at that time you need to go with Z38 series, followed by whether it is vaginal or cesarean. It depends on your documentation. Physician clearly documents that whether the patient has given birth vaginally or the patient given birth C-section. It depends on the documentation. That's the reason you need to review the document very carefully and assign the codes appropriately. Now, can we assign other chapter codes in newborns? Yes, of course we can assign, but that should be in addition. What does it mean? Let's take an example. If a patient has, newborn has severe sepsis. If a patient has severe sepsis, in that case, first you will be assigning newborn in sepsis followed by severe sepsis, because that code doesn't give a clear description stating that severe sepsis. It states newborn sepsis. In addition, we will be giving for information stating that R series, which is severe sepsis. This is how whenever we have to code from another chapter, yes, we can code in newborn as well as perinatal, but it depends whether the code description is completed or not. If the description is not appropriate with the documentation, then you, in that case, you need to assign additionally. Let me give an example. If a patient has, newborn has respiratory distress, we have a separate code, respiratory distress in newborn. No need to assign additional code from J series. Let's take another example of newborn sleep apnea. We have a separate code for that. We'll be coding newborn sleep apnea, don't assign in addition stating that sleep apnea, because the code description has complete code stating that whatever is available in the documentation, the same things reflecting in the code, so don't code additionally. Yes, of course, it is not completely ignored. When there is a need, we will be assigning additionally from other chapters as well. Now, do we need to code all the conditions in the newborn documents? Yes or no? If your answer is no, please watch this video. If your answer is yes, please watch this video. And if your answer is maybe or may not, still this video is for you. Whenever there is a documentation of newborn stating some conditions, for that conditions, if there is clinically evaluation or therapeutic treatment or any diagnostic workup, or if the length of stay is extended due to that condition, we will be assigning those codes. It doesn't mean that whenever there is a care, treatment, everything, then only we need to assign, because whenever a patient, a newborn has some condition, definitely some extra care, extra attention is needed. If that is not taken care of, then that condition is not so serious, or that condition might be possible or probable. We'll be learning in detail, do we have any separate code or any guideline in order to code suspected and possible conditions? Yes, we have. We'll be learning in next topic. And now we have learned about whether do we need to code all the conditions. It depends on the clinical evaluation and therapeutic, diagnostic, and whether the condition is reason to extend the length of stay. In that case, we'll be using. Now, whenever you see a patient or documentation stating that observation and evaluation of newborn for suspected or possible conditions, in this scenario, how you need to code? We have a separate code series which starts with Z05. Z05 we need to assign whenever the patient admitted for observation or evaluation, or if the patient is admitted for XYZ, then still they are suspecting something, you can code from this series. We have different codes in this series. For cardiac system we have different, for infection we have different, for neurological we have different. We have so many codes in this series, but remember, you need to go with Z05. Now, when you need to assign Z05, can we assign Z05 in combination of Z38, which is newborn delivered in hospital through vagina? Do we need to code Z38 as well as Z05? Here is the answer. We can code both the conditions. But there is a small key here. Listen that key. First one would be, if your principal diagnosis is Z38, that means now and today the patient has gave birth, we are coding first time for that newborn, first time for that patient, we'll be assigning Z38, followed by if any suspected condition like infection disease is suspected or any other condition is suspected, in that case you will be coding Z08 in addition. Clear? Second one, Z05 we can assign first listed diagnosis when the patient is again admitting to the hospital for any suspected conditions. In that case you will be going with Z05. Whenever you are assigning Z05, don't assign Z38 additionally. Z38 we will be assigning only once for that patient. If the patient is delivered or gave birth today, for that newborn we will be assigning Z38 as first listed diagnosis. Never and ever we should not assign Z38 as second listed diagnosis, whatever might be the situation. Clear? This is how we need to code whenever you have suspected conditions as well as newborn delivered, suspected conditions without newborn delivered. This is how we need to code. Now, as I mentioned, whenever you are coding any condition which is needed additionally to prove, to justify the patient has so and so conditions, you need to remember these things. Whether that condition requires any treatment or whether any further investigation is needed in order to prove whether the patient or the newborn has that condition or not. As I mentioned, there is any extended or prolonged of length of stay which matters a lot, because if something is there, then definitely they will be having some mindset stating that that patient has developed so and so